enhancer wanda zai boosting, you know, particularly the reason for taking that particular medication. So idan muka duba kuma again, now kafin mu je ga principles din, muna da wani abu da ake ce masa drugs nomenclature. Shi drugs nomenclature wato yanda aka categorizing drugs in names na drugs. Kowane drugs yana da sunaye guda uku wanda kowane student nurse yana da kyau ya sani. Wannan sunaye guda uku yana da kyau mu gane cewa one drugs can have as much as 3 different names, as I earlier said. Muna da one chemical name or scientific name. Kana iya karanta kowane drugs da ka sani yana da chemical names. Chemical names, you know, any typical organic name based on the molecular structure, such as acetaminophen. Let me just give an example of this. You know, it's one of the nomenclature of the drugs, you know, that is called acetaminophen. So kaga idan muka duba acetaminophen is one of the pain reliever. Kaga muka duba generic name ne acetaminophen, and muka duba brand name din shi kaga muna da Actamine, muna da, you know, Anacin, duka waɗannan sunayensa ne. So this is something that I want to like give example of if I talk about chemical name. Now wannan na ɗaya ke. Na biyu kuma muna da generic name wanda duk duniya shine is given by the manufacturer who first developed the drugs. So it is before the drugs, you know, becomes official, such as Panadol. You know, when you talk about this, when you look at when we talk about generic name, it's a name that is given international name. So it's an international name that is given to the drugs, which is worldwide, you know. And so when we talk about example, we can say metronidazole. Metronidazole is the generic name. But when you say Flagyl, it's the brand name. That is the market name, you know. So one generic name, you can call it international name, you can call it generic name. So it's worldwide. One shaki kara, the other name for a drugs. The last name for the drugs is what? Is brand name. You can call it brand name, you can call it market name, you can call it market name, brand name, or trade name. You know, wato suna na kasuwa. Wanda zaka ga muka ce Flagyl, Ugil, you know, Unogil, different names from different companies. That one is the company, is the owner of the manufacturer. Those people that manufacture, that pharmaceutical companies that produce the medication, su za su bashi suna. But dole zama da cewa akwai generic name a jikin wannan suna. So wannan na ɗaya daga cikin abin da ya kamata mu sani kafin mu je medications, kafin mu je principle of that medications. So now, in the principle of medications, you know, medication administration, akwai wasu abubuwa da ya kamata mu yi, wanda shine principle include 3 checks and 10 rights. Sometimes you may see 6 rights, we have 10 rights, we have 6 rights. So depending on the school of thought you are using. Now the 3 checks must be done in the principle of drugs administration. Sai kai abu guda uku kafin nan. Check when obtaining the container of medicine. Dole sai kai checking container na medicine din, wanda yana da kyau mu gane haka. Sannan the second thing, check when removing the medicine from the container. You must also check when you are removing the medicine from the container. Lokacin da kake cire maganin daga container sai kai checking. You understand? Lokacin da ka obtaining container kai checking. Lokacin da kake cire drugs kai checking. Sannan check when replacing the container. Idan kana replacing container, then you must check again. These are the 3 checks that you must do among part of the principle of drugs medication. So now let's look at the medications rights. How many rights did we say? We have 10 rights. That 10 rights, we have to consider them is one of the medications errors that can be harmful to patients. There are some things you have to avoid while giving medication. So let's consider this thing as one of our principles that we must follow while administering medication. Now, right medication. 1R is right medication. You know, right medication, you can say right drugs. Now, when administering medications, the nurse compares the level of the medication container with the medication form. Dole sai kai comparing. ka comparing ka tabbatar yes drugs ne ga wanda aka prescribing ga wanda aka ce ka bayar, ka comparing ka duba ka ga shine yes shine. You have to check, you understand. So the nurse does this 3 times. You are not expected ka yi shi sau ɗaya sau biyu, ka yi shi sau uku, ka checking ka comparing so that ka tabbatar da cewa you are serving the right medication. So wannan na ɗaya daga cikin abin da nurses suke kula da shi wajen administering medication. A R na farko kenan, right medication. R na farko kenan, before removing the container from the drawer or shelf you have to check. Wannan shine idan muka duba 3 checks da na faɗa ɗin nan, dole ka yi shi a wannan right medication ɗin. As the amount of the medication orders is removed from the container, by the time maybe let me say they say is 20 milligram you want to administer, that 20 milligram as you remove it, the amount you have to check to ensure that it is that exact 20 milligram that you are serving. Before returning the container to the storage, you have to do that. As you are returning it to the storage, that is the 3 checks I have earlier mentioned. You can generally use them everywhere. So that one is right medication, right drugs, compare the drugs. Number 2, right dose. Now, right dosage, you know, as a nurse, you are expected to administer what has been ordered by the physician. Tun da likita ne zai ordering maka me za ka yi sabin, so it's very very important for you to perform medication calculation, you know, or conversion. You either convert or you perform some calculation before you administer the medication. That is, you are trying to get right dose. Kana so ka samu right doses. So the nurse should have another qualified nurse check the calculated dose. If in case peradventure there are some medication da za ka yi calculation ne, bayan ka yi calculation ka tabbatar da at least ka samu wani nurse da zai maka me, da zai maka abin da ake kira recalculation. In ya kara calculating sai ya tabbatar. Right dosage kuma in the sense that if the drugs doesn't require you to calculate, you have to make sure and you check on the level of that particular medication da za ka yi serving, so that ka tabbatar ka yi serving right dosage. Now right dosage, that is how you will do it. And you know, sometimes the dosage for kids, the dosage for adults, the dosage for infants or neonate is also different. So you should be very very careful, because a nan ne za ka iya kawo error da za a iya samun matsala. Now the third R na uku shine right client or right patient. Right patient or right client. It is an important step, very very important step in administering medication safely, is being sure that the medication is given to the right client or right patient. Dole ne ka tabbatar da medication in kana ba da shi wa right patient. How do you do that? At least you should need to confirm the patient's name to identify the client correctly by calling him by his name. The nurse check the medication administration form against the client identification bracelet. You know, when you have wristband, you know, wristband, bracelet, you can check the patient's name and ask the client to state his or her name to ensure that the client's identification bracelet has the correct information. Despite you have seen the wristband, you need to ask, are you Mr. Abubakar? Are you Mr. Fashkar? You need to ask. Yes. Are you Mrs. Fasuma? Are you Mrs. Jacob? You have to confirm the name so that you know you are trying to serve the medication to a right patient. Kada ka yi abin da ba shi bane wajen baka confirming ba, kawai dan ka ga mutum akan gado ka dauka cewa yes ai shine akan gado. No, it's not possible. Sometimes patients can lie on the bed. Sometimes patients used to exchange bed, especially here in Nigeria. You may see those challenges. You may see patients on the bed, but it's not the right patient on the bed. So right patients you have to confirm, so that when you call the patient by name, you have to understand that this is the right patient. Now let's check the R na hudu shine right routes. Right route shine muke magana. If the doctor's order doesn't indicate a route, of administration, so the nurse consult the prescriber. In case peradventure the doctor did not indicate the routes, maybe bai ce IM ba, bai ce oral ba, bai ce IV ba, bai ce maka komai ba, dole ka ka consulting prescriber. You must meet him so that he will put it. Likewise, if the specified route is not recommended, the nurse should alert the prescriber immediately, meaning he must specify where he wants you to serve the medication. You can't just leave the medication without asking or consulting the prescriber to give you the right route to serve your medication. They're very, very, very important. So now the next R, you have to know, right route. Definitely we say, for instance, let me emphasize on this. When we talk about IM, you are to serve IM 90 degree. When we take off intradermal, you are to serve it 15, 15 to 5 to 15 degree. You understand? When we say subcutaneous, you have to serve it 45 degrees. So you shouldn't just go and serve medications anyhow. When we talk about IV, you must ensure that the medication is inside the pen before. That is right route. As you are following, even if you have the right route, you must make sure that you are following the right location of where you are serving the medication. You can't just come and they say you should serve IM, at 90 degrees, and you went ahead and started at lower quadrant. You have to side at upper outer quadrant. Kaga kana duba asalin side da aka ce IM din ne, but don't give it another side. Even at the buttocks, at the deltoid muscles, at the femur, you have to know outer aspect of the thigh. You have to know where to and how to serve it. Definitely is one of the major things in the principles of administration of drugs. Now the next R, shine R number 5, right time. The nurse must know why a medication is ordered for a certain times of the day, and whether the time schedule can be altered. Yes, you have to know the time. Why have they said this medication should be taken every 8 a.m. OD? Why is it that? Why did she say you should take this medication every 3 times, 8 hourly, for instance TDS, for instance 12 hourly? You have to know why. You understand, as a nurse. If you have altered it, what will happen? If it has not been altered, what will happen? This is something you need to know. Each institution has a commended time schedule for medications order as frequent interval. You may see it's depending on the hospital setting. So hospital setting, the way they perceive some of the time they fix for medication, it varies or is different with others. So you should also consider that medication that must act at a certain times are given priority. E.g. insulin should be given at a precise interval before a meal. So these are so many things that we normally consider. But so one thing I want to add here is abunda ake so shine medication right time. An ce TDS. How do you serve TDS? 1, 8 hourly. Every after 8 hours you are supposed to serve it. That's why we keep patients on bed. Shi yasa muke ba patients gado don mu ba da medication safe, yamma da kuma dare. Karfe 8 na safe, karfe 4 na yamma, karfe 12 na dare. Idan kai ne karfe 12 na dare, ba za ka yi ka tashi ka sha magani karfe 12 na dare. But our patient is on admission. You are expected to give it for TDS 8 hourly, 8 a.m. Then you give him 4 p.m. Then you give him 12 a.m. That is 24 hours, 8 hourly. If it is VD, you have to understand that you should give the patient's medication 6 a.m. and 6 p.m. That is something about that. It's very, very important. We also serve this medication that way. So this is something about what we normally do to a patient that is getting medication. Now the next R is right documentation. So right documentation is an important part of safe medications administration. When the documentation for medication should clearly reflect the client's name, the name of the ordered medication, the time, the dose, the route, and the frequency, and the nurse sign medication sheet immediately after administration of the medication. So you are expected as a nurse, when you administer the medication, definitely you are expected to document. That is right documentation. So right documentation is part of what you have to do. Documenting time, medication dosage. You have to document the route that they apply. Documenting frequency, you understand. You have to also sign. Countersign is very, very important. Put your name, your status, and your signature. Is part of the R that we have been talking about in the drugs administration. Now the next thing you need to understand, we have apart from this, these are the 6 that I had mentioned. Now, write information on the drugs, Right client education, right information. You are supposed to give patients information about the medication he is taking. Sometimes we don't tell them much about the medication they are taking, so give the patient right information. You are expected to teach a patient. You have to tell him what exactly you are teaching him, what you are giving him. So has the right to know. The patient has the right to know the drugs he or she is taking, desired and adverse effects, and all there is to know about the medication, which the patient has right to refuse medication. You have to also know the patient has right to refuse medication. When patients say I don't want, so you don't want, don't force him to have the medication. So patient has right. However, the nurse of the public, to explain the patients why the drugs is prescribed and the consequences of refusing medication. Then when you do that, you are okay. Tell him the consequences of refusing the medication and why he was asked to take the medication. Then it is good for him to have that knowledge in what he is supposed to have. Then the next R is what? Right assessment. Some medications require specific assessment before the administration. So checking of the vital signs, there are so lipo or digitalis medication that you are serving to patients that has heart problem. You need to check. Right assessment is very, very important. That you must do vital sign before you give the medications. You understand? So before a medication like Dosage, is administered, the pulse must be checked. You have to do that. Then, as I earlier said, I had mentioned right documentation is part of it, and these are some of the things. So zan tsaya a nan a wannan video, zan tsaya a principle of drugs administration. A principle of drugs administration mun yi magana right principles. I talk about 6R and I have added about 4R, which is making them almost 9 to 10. So these are, when you follow this, ka bi waɗannan matakan, shine kana magana principles of drugs administration. Abu dai mai muhimmanci shine mu gane cewa lalle wannan shine yadda muke so mu dinga ba da lecture din bit by bit. Yanzu na tsaya a principle of drugs administration, idan na ci gaba da wani video na zan tsora daga inda na tsaya. So ba abin da muke so da Allah ku taimaka ku yi mana subscribe na wannan YouTube channel Mr. Pashka Nurses. Mr. Pashka Nurses TV a koda yaushe muna tare da za mu ke ba ku tabbataccen bayanai da lecture da wasu health of wasu abubuwa da suka shafi nursing da kuma kiwon lafiya ba. So daga ƙarshe dai ina so in ce mana duk wani mai tambaya yana iya tambaya a wannan comment section din. Insha Allah za mu ga yadda za a yi. Don akwai wani kuskure da gyara, please door is open. You are free to take also advise us and even correct us as well. I remain Nurse Pashka, Nurse Educator, from Mr. Pashka Nurses TV at this Pashka tutorial class. Subscribe, like our
One step is weight your hands. How do you weight your hands? You must weight your hands from below the arm.
We are called to serve humanity, endowed with the art and science of caring.